Good morning.
Hi, good morning. I'm here for my appointment.
Okay, my name is Aqua. I'll check you in. Do you have your ID and your insurance card?
Yes, I do. My name is Terry ZZ Test.
Thank you. And would you please verify your emergency contact?
It's my husband, and his number is 734-655-7902.
Thank you. And please verify the last four numbers of your phone number.
It's 1256.
Thank you. Any changes in your demographic information?
No.
Here is your ID and your insurance back.
Okay, great. Thank you.
Thank you. So you're all checked in. My name is Aqua. Let me know if you need anything, okay?
Okay, thank
All
you.
right, thank you.
Patient has arrived, so I'm going to put a white dot that's indicating that the medical assistant is getting ready to room the patient. I am checking my problem list and my health maintenance to see what is due. I'm checking to see if the patient's height and weight is due, and the patient's height and weight is due. Okay, now we're ready to go and get the patient. Miss Terry ZZ Test. Hello, how are you doing today?
Good, how are you?
Good, come on in. My name is April. Okay, Miss Tess, I'll have you come over here and step on the scale and we'll get your weight. Okay, now I'll have you push your back up against the wall. Let's get your height. Okay, we're going to be going right here to this exam room to your right. You come and have a seat there for me. Just logging into here. Epic, you doing okay today?
Yep, yep.
What brings you in to see us?
Some shortness of breath and follow-up of medical problems.
Okay, how long has this been going on?
About a week.
Okay, shortness of breath for about a week.
Mm-hmm.
Any allergies to any medications?
No.
What pharmacy do you use?
Just the lobby pharmacy.
Just the lobby pharmacy?
Yeah.
I'm updating the pharmacy information here.
Mm-hmm.
Did you need any refills on any medications while you were here today?
Not today.
Over the last 2 weeks, how often have you been bothered by the following problems? Have you had little interest or pleasure in doing things?
No.
Okay. Have you been feeling down, depressed, or hopeless?
Nope.
Okay. That takes care of your depression screening. Okay, I see you're due here for some blood work and a colonoscopy screening. So I'm going to go ahead and place those orders for the doctor to sign off on, and they'll discuss that further with you.
Okay.
So I would go into add orders, and then I would tee up the colonoscopy, her lipid panel, which is for the cholesterol check. Click and save those orders. And then, have you had your flu shot this year?
No, I haven't.
Would you like to receive your flu shot today?
Yes, I would, please.
Okay. So I would then go in and order her flu shot for her. And sign off on it, and I would give her flu shot before the doctors come back in. So that way that's taken care of, but she doesn't have to wait for after her visit to receive her flu shot. I'm going to input her height and weight. I'm going to do her tobacco screening. Do you smoke tobacco products?
No.
Any type of smokeless tobacco products like snuff or chew or
Mm-mm.
vapors?
No.
Are you currently pregnant?
No.
So now I just need to get a quick set of vital signs for you today. And then we're going to check your A1C. So that will involve a finger stick for you today.
Okay.
Okay?
Sounds good.
Okay, let me grab my vitals machine. Okay, blood pressure was good today.
Okay.
122/78. Okay, and then I'm gonna check your A1C. I'll enter in your vitals. Start with the alcohol swab here of your finger. You might feel a small prick. Okay, I'll go get this test started. Just hold pressure there, and the doctor should be in momentarily, okay?
Thank you.
Now I'm going to turn the dot green on the schedule so the doctor will know the patient is ready to be seen. Okay, so I just turned the dot green, and I'm securing the workstation, and the doctor should be in momentarily.
So now I see that the dot is green and the patient is in room 27. So now I will go see the patient. Hello there, Miss Test.
Hi.
I'm Dr. Giles. Nice to meet you.
You too.
So what brings you in today?
Some shortness of breath, breathing problems, and some follow-up of my medical conditions.
Okay, tell me more. All right, so let's review your vital signs. Everything looks normal, so I will mark as reviewed. Do you have any allergies?
Not that I know of.
Okay, so we'll review those as well. And then let's take a look at your home medications. Are you taking atorvastatin or Lipitor, 40 milligrams daily?
Yep.
Are you taking metformin, 500 milligrams twice a day?
Yes.
And are you taking nifedipine or Procardia, 30 milligrams?
Not anymore.
Not anymore, okay. So I will click not taking and remove it from the medication list. And the reason will be inactive medication. And then I will review it. Now let's take a look at the results to see your A1C from today. And now I would examine the patient. Now that I've finished my interview and examination, I will go talk to my staff physician, Dr. Omar. So I've got Miss Z Test for you. She's a 65-year-old woman with a history of diabetes, presenting today for shortness of breath.
I agree with your plan. Let's go see the patient.
And now I would explain the diagnosis and plan to the patient. So now I will review the diagnoses for today. Main complaint was shortness of breath, so I'll add that to the problem list for the day. I will make that the primary problem by changing the blue dot and by changing the order of the problem list. Then I will add her chronic medical problems to the list by going to problems, adding type 2 diabetes and essential hypertension. Then I will check the orders entered by the medical assistants. We've ordered an influenza vaccination, a colonoscopy referral, and a lipid profile, all of which we've already discussed with the patient. Then I will add my own orders, including a chest x-ray, and a referral to pulmonology. Then I will associate all of my new orders with my previously added diagnoses. Then I would go and sign the orders. Okay, so now that we've discussed and finished the plan, it's time to wrap up and discharge the patient from the clinic. I'll start with setting her up with a follow-up appointment in 3 months. And then for the level of service, I will select established level 4 as previously discussed with my PCP. Then I will exit the chart and I will change the dot to red so that the medical assistant is aware that the patient is ready to be discharged.
Okay, I see the dot is red, so I'm going to start the checkout process by turning the dot white. and printing the patient's ABS summary. I'm reviewing the visit orders to see if any referrals was placed today also. So I have a referral placed for a pulmonary colonoscopy and a flu vaccine. Hi, Missy. Hey, April again. Can you verify your date of birth for me, please?
12/30/53.
Okay, thank you so much for that. Okay, so I have your after visit summary.
Okay.
Your doctor wants you to return in 3 months to see us. And then also the doctor has ordered a chest x-ray for you.
Okay.
You can have that done on floor 3. You just go down to floor 3 and sign in. You don't need an appointment.
Mm-hmm.
And then the doctor also orders some blood work. So the blood work is done on floor 1. As soon as you get off the elevators, you'll just make a quick little left down to the cubby hole.
Mm-hmm.
And then also the doctor wants you to follow up with pulmonary, so we can schedule that appointment at the front desk here for you today.
Okay, wonderful.
Do you have any other questions before we go to the front desk?
Not right now.
Okay, you can follow me.
Thank you.